really the major is what the universal healthcare system is all about. And I think we still have the three major challenges. For me, while we can talk about availability, affordability, and quality, for me, the major challenge is how to integrate the strength of the two verticals, which is the public and the private healthcare services. We have to accept one single fact, that the two are major portals of delivery of healthcare in the country. The public sector has the reach, has the accessibility, but doesn't, unfortunately, gets overburdened and therefore can't maintain the quality, the infrastructure, the high level of techniques and technology, and the increasing cost of advanced healthcare delivery. On the other hand, the private sector offers efficiency, offers expertise, offers infrastructure quality, but at a cost factor which becomes not very affordable to at least most of the common man. Now look at the strengths of the two, because if you want to deliver healthcare to 1.2 billion people, it's actually the strengths of the two combined together can actually make it happen. And yet, what we keep looking is at the deficiencies of the two. So this needs to, the public and the private need to sit around on the same side of the table. Actually believe, the government needs to believe that we've got a great ally in this private sector, which we helped to create in a manner. After all, it was a default strategy of the government not being able to provide that level of care and that level of expertise and infrastructure which led to creation of the private sector models, whether nursing homes or whether it's corporate healthcare. But that's what led to it, and lets us therefore consider the two as allies. And the government should look at the private sector and say, gosh, this is fascinating. I have the best ally possible to be able to deliver healthcare efficiently downstream. And the private sector should say, gosh, I've got a great ally in the government, because I can go downstream to even smaller and smaller towns and have that reach and the volume to be able to deliver healthcare with some profitability because of the volumes. I think it's a great thing, and I would see the saddest part of it is when a private healthcare provider opens up a 100-bedded hospital next to a district general hospital, and the patients are flocking out of the district general hospital and then paying huge amounts of money having treatment in a private hospital only because the government can't provide it, and yet they could have married together with the same infrastructure to actually have served the public. So that, I think, is the biggest challenge that we actually talk about. And the second biggest challenge is realizing that delivery, as we go down the model and have to provide it at a highly subsidized rate, or in some instances free, the quality issue still has to be maintained, and that has to be transparent. So a patient in the village or smaller town has the same right to have quality care, to have outcome measures, to have the best of everything as anybody being treated in the metro cities. We actually have to combine, therefore, many factors together. There's also one other point which I always keep wondering. The policy makers have a major task on their hands. And the major task is for the 1.2 billion people. But the measures which we've got to transform this country in healthcare cannot be populist. They should not seem to be populist. They have to benefit the population. And there's a difference between the two. The populist measures seem good, seem great, but may not have any effect. It's what we've got to transfer those populist measures to actually benefits. And the visually, what may be not be beneficial now would actually be beneficial in years' times. And that's what we have to have in our heart. Is this measure that we're instituting going to actually benefit people's health? Or is the benefit in some other terms? The opportunities are paramount. And opportunities are paramount because healthcare delivery to 1.2 billion people always makes innovations an aspect of healthcare delivery. And as you know, Indians are best brains in that. So there is innovation opportunities. There are models in every sphere of e-technology, and I compliment you for holding such a great meeting today, whereby brains which have been thinking of the best and most frugal ways through e-technology to deliver healthcare in this country are all together. The brains are already working to see how we can combine together to deliver that at an affordable cost, because this is what all e-technology is about, to delivering it to masses at a much lower cost. And then partnership between various organizations so that a larger scale of people could be covered. Then there is, so all these models are a great opportunity in succeeding to what we call a universal healthcare for all. But the problem is, and I tell you where the problem lies, and we've got to think through this if we want to succeed. It's a great infrastructure, it's a great seeding for innovations, but we are also thinking that healthcare delivery cannot be a philanthropy. It cannot be a no-win situation for some and a win-win for all. It will come at a cost. Innovations, ideas, hard work, transference into real time, etc., cannot be a philanthropic mission for everybody who's come here to participate in it. And therefore, we got to define for them as to what are their advantages. So while the advantages will come out of partnerships between the government sector and the private sector, amongst the innovators, amongst the entrepreneurs, amongst the same young individuals who are creating small hospitals for healthcare delivery, a great opportunity exists for the government also to utilize them. It has to be that stakeholders, and the government should encourage that, and the private should actually encourage that, and have a trust model based, whereby one can sit around the table and say, listen, we want to create a win-win, and in that round table, which should not be either side of the table, it should be a round table where the stakeholders still sit next to each other, would be the model which actually is a win-win for the innovators and the scientists. It's a win-win for the industry. It's a win-win for the government. It's a win-win for the corporate healthcare deliverers or the private healthcare deliverers. It's a win-win for the doctor, and it's a finally all together in the center is it has to be win-win for a patient. He also has to be represented as a stakeholder in every creation that we actually do as we move forward delivery of healthcare. We cannot sit on opposite sides of the table and say, it's us who make the decisions, and if you want to fit into it, you fit into it, otherwise you stay out of it. And healthcare will never get delivered in this country. So opportunities are profound, and opportunities can still be win-win. But let's not look at each other with suspicion, and let's not just believe that in this space of healthcare delivery, for example, in every other space of industry, if you're an innovator, if you're an entrepreneur, everybody's out to discuss it with you. And in fact, if you make a lot of money from the entrepreneurship, everybody congratulates you. And you'll be published on every paper, and even if you visit one of the government offices, everybody will say, please sit down. And you made billions out of an idea. And you looked upon as a great innovator, great entrepreneur, great business mind. The moment you have a great innovation in healthcare, and you present it in healthcare delivery, and you actually sit across the table from any official or any person, they look upon you and say, gosh, he's out to make money from healthcare, as if that should have come as a philanthropy, as if you shouldn't be earning anything from all the efforts that you put in. You're not even supposed to earn your daily bread from that. Yes. You're supposed to just give it. Because it's health. And that's the sad way to go forwards, because it's going to actually take away the quality, it's going to take away the delivery, it's just going to actually leave this country in the dearth of space. So my mind revolves around the fact that if we got a vision for 2025, if we got a vision for 2030, it has to be a sustainable vision. It can't be temporary, it can't be knee-jerk, and it cannot be without the robust public-private partnership, which is sustainable. Oh, yes.
So there are three angles and perhaps four angles.
Right.
So this complex where
Yeah. The unfortunate aspect of every aspect of this whole scenario is that our medical education system is at fault. And in a way, as a country, we are at fault that while on one hand we're deficient of 600,000 doctors and need to produce more doctors, we are again by default strategy getting medical education taken over by default strategy into a private medical college business. So on one hand, lack of good facilities from the government created the private healthcare over the last 30 years to take care of nearly 70% of the patients in this country, and that's what relates to the out-of-pocket expenses of the patients. And while they say it's a good thing that has happened, but it's a default strategy. And as far as medical education is concerned, I still believe that because there are more medical colleges in private than in the government sector. And why couldn't we have created over a period of time more and more medical colleges which are government, which are subsidized, which actually mandate that people work in the rural sector for 5 years because we get subsidized training and education, than to actually have so many private medical colleges flourish who charge high amount of admission and capitation fee, so that when a person actually, when a young student gets into that after having paid a high capitation fee, his immediate ideas in mind revolve around a business or the profession as a business rather than as an education, rather than as a person that he's actually created to help out.